We all know that we are far from perfect. We are recording. I hope everybody made it back in. And we're just going to keep going. We're going to start with Cassie. And Cassie, you want to just introduce yourself real briefly, and then Robert, and then Dave?
First, hi everyone, my name is Cassie Gelly, and I'm actually a youth support coordinator with Children's System of Care, but I'm speaking today on behalf of the Speakers Bureau about some of my lived experience.
Thank you. Robert.
Hi, my name is Robert Salinas. I currently work as a Friends and Family Coordinator with Cal Voices, soon moving to become a peer partner with Cal Voices in Sacramento, also part of the Speakers Bureau, in here share my story of recovery.
Beautiful, thank you. Dave.
And I'm Dave Davis. I'm a clinic nurse supervisor in Santa Cruz County at the M-Line Clinic. Also here to share my experience as a recovering sober guy.
It's beautiful to see you all. So Shelley, can we go to the first slide on stigma? We'll see if we can catch up a little bit so we can hear from these wonderful panelists.
Yes, just one moment. I'm having trouble getting it back up. Technology, bear with us. It's loading. Oh gosh. It's being very slow. Okay.
If you let me share, I can pull it up.
Okay.
All righty. So.
Are you finding the final copy?
I'm good.
Okay.
Just allow me to share. Okay, we good?
Yes.
All righty. So back to a nice deep regrouping breath. So
yes.
The thing that I want to talk about is that stigma is prevalent. It's part of the bias against people with substance use disorders and behavioral health. And the part that we often don't speak about is how it directly impacts the human being who is seeking help. And all of us here in this panel understand this very directly in our own experience. So I've really been encouraging the world to think about the injury that occurs from repeated disdain, repeated rejection, repeated lack of care. So imagine what it is like for a person who has suffered from a severe substance use disorder for decades, encountering stigma at every door. A secondary injury has occurred from the seeking of help, a stigma wounding or injury. Stigma it comes in many forms. It's structural, it's institutional, the political will is really impacting this. It's an expression of indifference. The congressional allocation of funds with slow response to the opioid epidemic. Underfunding is an ongoing part of our reality as we scramble every single day to patch together care. So stigma impacts how much, what we can provide in terms of care. Medical settings, often we have encountered contempt and decreased care time. This has been studied throughout the world. of someone presenting with a substance use disorder, seeking relief in some way, their care time is diminished. I'm sorry. Emergency department, hospital, primary care settings. It's only recently that we have gone to a whole new level of understanding, providing care. California Bridge program, which is truly wonderful. And find out about it if you wish. Throughout the state of California, we now have ERs that say welcome to people who are struggling with opioid use disorder. And we all know that the justice system and law enforcement have been often the default place. Withdrawal management in jails can be really old school, not state-of-the-art medications and unkind. There's a lot of work to do there, and we are doing it. Stigma has its many forms. It shows up in our cultures, in our families. There's family shame. Those of us that have grown up in families where alcohol and substance use was a problem, we learned early to keep the family secrets. Treatment settings, up until recently, a counselor would be very focused on when you were tapering off of your Suboxone rather than the work of stability. So this has been a huge shift in treatment settings. Recovery settings, and I am a recovering person who values the 12-step world, but we do have work to do, and people who have been prescribed medications to treat their addictions, such as methadone and buprenorphine, are often not considered to be clean in the room. So that's work that has to be done. And just wanted to point out that Medication Assisted Recovery Anonymous is a welcoming 12-step program. So if anyone has interest in going to a safe, welcoming environment to work the 12 steps, and they are already prescribed medication. So every form of stigma impacts a human being. While encountering stigma such as the less than compassionate care, minimal access to best treatments, the person can become more hopeless. This hopelessness contributes to the deadliness of the addictive disease. Those suffering from this kind of wounding become fearful and distrustful of settings and to provide care. And asking for help every time becomes more difficult. And over time, this stigma injury also requires care. So what do we do? How do we provide care for an identified stigma injury? We begin by acknowledging. Often when I have sat with my patients over the years, we talk about this. And it really is important that we listen and offer humility. Yes, we are not doing really well in this area of destigmatizing and offering appropriate care for your chronic illness. This is an important thing, is we need to own not only the problem, but the solution. Rebuilding trust, we partner with our patients with respect. We abandon the paternalistic approach, and we always offer welcoming and support. And language of dignity is respect, respect, respect. Also, treating the stigma injury involves being trained in trauma-informed care and communication. Just about everyone who has suffered from substance use disorder has co-occurring childhood trauma or PTSD or other co-occurring behavioral health diagnosis. So we need to understand not so much why the addiction, but why the pain. That's how we do this. And we use person-first language, and we'll get into that in a second. And education transforms all environments. Education providers, settings, educating families and communities, as we are doing now. So this is stigmatizing language that we no longer in use. We have gotten rid of the word abuse. It was the only word in the medical lexicon of diagnosis. We now use the word misuse or use. We'll still see it and hear it, but it is a word that we no longer use as it is pejorative. We really don't use the word addict anymore. We'll say person who is with substance use disorder, people who inject drugs, person with alcohol use disorder. The term addict is still used in the 12-step culture as a part of the recovering process. If I was in a 12-step meeting, I would probably say, I'm Katie, I'm an addict. So we're not going to change that. That's part of that culture, but that's, and from where I sit, it's the only appropriate use of that word. We've also eliminated the concept and the idea and the perception of drug seeking, med seeking. If someone walks into a medical setting looking for some help, the perception is not that they're drug seeking, but they are seeking some kind of relief. Focus on the person rather than the perceived behavior. We never describe a medical lab result such as urine drug screen as dirty or clean. We've done a good job of cleaning that up, but in case you find yourself referring to a drug screen as dirty or clean, make sure that you work on changing that, because it is probably one of the most common stigmatizing words that are out there. So that is all I have on the slides, and I am going to invite Cassie to kind of give us a quick experience, strength, and hope a little bit, and you can frame it around the stigma or not. And then after Cassie, we'll go to Dave and then Robert.
Hi everyone, my name is Cassie Gelly, and I'm what many of us would refer to as a former at-risk youth. I come into this meeting to share a story of recovery, a story of trauma, and a story how, even with all the burdens I faced, I was able to overcome them through many services still offered at Placer County's Children's System of Care. At age 12, I faced the biggest heartache I could ever imagine when my mom suffered from a burst brain aneurysm, leaving her paralyzed on her right side, the cognition of a child, and no recollection of who I was. Her aneurysm was a result of meth addiction. I found with her loss and the abuse I suffered at home by my dad and stepmom, who also struggled with addiction, I no longer felt a fear of disappointing anyone with my negative choices. My addiction first started, like many young people, with cigarettes and marijuana. As time progressed, I was introduced to harder substances, as well as dealt many additional traumas. Between the ages of 12 to 15, I was conquering physical abuse, mental abuse, sexual abuse, peer pressure from my family and friends, the loss of my mom, being placed in and out of foster care, struggling with meth addiction on top of the everyday struggles in becoming a teenager. I attempted to reach out to school counselors about the abuse at home, but after disclosing my self-harm scars, they just sent me to the ER and notified my dad of the incident. When my dad and stepmom separated, we lived in his warehouse 30 minutes away. He would forget to pick me up from school sometimes, days at a time. He also sent me to the Crisis Resolution Center. The max time we could be there was 30 days. Our family was to participate in counseling weekly. My dad did not participate in a single appointment and picked me up late on the 30th day. I made a few trips to the receiving home, but after a few weeks of being locked in this house with none of my supports or being allowed to attend my school, it always felt more like a punishment and I would run away. Instead of my social workers understanding how it felt being placed in this atmosphere with no clear idea of a home, they would send me back to my dad as a girl who was just acting out. Through all these events, there were many adults who attempted to save me, but with an instilled fear of child welfare, counselors, and my natural unwillingness to allow people within my life, I managed to push them away, losing the opportunity to receive better coping skills. By age 13, I received my first felony charge and probation entered my life. I feel that with my continued running away and marijuana use, they thankfully chose to place me on juvenile probation. Once I started testing positive for meth, my PO did the best thing possible for me. He referred me to Juvenile Family Treatment Court and a few sessions of functional family therapy. I feel this officer was the first person to set a path for my recovery. He acknowledged that I needed a program that offered more support than he could offer alone. At that time, JFTC consisted of 3 phases, where you were only allowed a certain amount of sanctions before you were exited out of the program. I used all my sanctions within phase 1, and many of my peers never even made it to phase 2. Throughout phase 1 and 2, we were required to attend multiple treatment meetings as well as gain employment prior to entering phase 3. And phase 3 is where I really started to finally encourage this change in my life. We met in a small group with a juvenile substance abuse counselor. All the supports made a tremendous difference in my life, but it was not until I built the connection with my counselor and my PO that I started to see my worth. I can't recite much of the treatment program today, but I remember that they said they were proud of me. They occupied my time with outside meetings that made it easier for me to break those negative connections. They placed me within temporary foster homes that they trusted, and all these supports cheered when I graduated drug court at 15. Unfortunately, this wasn't the end for me, and I did relapse upon graduation. I immediately regretted my choice to use again and asked for someone to bring me to an AA meeting. This led to my last time using and my freedom from my father. I became clean and a fear of losing my freedom, but I created a recovery story because a team I once feared showed me compassion, humanity, and self-worth. Through their support, I found that I can enjoy life without drugs, I can feel my pain and overcome it in a healthy way. Although I received this new perspective, I was still lacking something, the knowledge of what a family should look like. After the loss of my mom, I found many replacement moms that would try to force themselves into my life. Yet they always felt I was too much to handle and eventually left. That's when I met my ex-husband's Aunt Dawn. She was patient and she was always there for me and showed me what I wanted to be as a mother. I did manage to push her away by allowing my fear of abandonment to put strain on our bond, but I'll always be grateful for what she taught me. In the end, I found it was one or more caring adults that helped me grow beyond my circumstances, which is why I now work as a youth support coordinator. I am Cassie Gelly, once the face of an at-risk youth, a loose cannon, someone who will never amount to anything. Yet here I stand 15 years later. I'm something. I'm a hero to my 4 kids. I'm a loving wife. I'm a dependable coworker. I'm my mom's caregiver. I'm a homeowner. I'm working in a field I feel passionate about, giving back to at-risk youth as probation did for me. I'm happy with who I am, and I can never claim all this if I never allowed a caring, positive set of people into my life to help me see that I can grow to be more than just a product of my circumstance.
Oh, beautiful. Thank you. Thank you, Cassie. I just want to let the audience out there know that if you have questions or comments, Shelley is going to be managing that. So just hit the Q&A button on your Zoom screen and we'll try to manage any questions that we have. We're next going to hear from Dave. Dave, is your audio on? Yeah, hi Dave. Nope, can't hear you. Unmute.
Unmute. Can you hear me now?
Yes.
Wonderful. Well, thanks for inviting me to be a part of this, Katie. I'm Dave, and I've been an advanced practice nurse for 25 years, but I've been an alcoholic and addict for a lot longer than that. I wanted to talk a little bit about the stigma and how that affected my path into recovery. But, you know, started drinking at a very young age and advanced to anything that was able to change the way I felt inside, because I'm definitely a garden variety alcoholic. And I apologize in advance. I speak the language of 12-step recovery, but am evolving to use kinder, gentler terms, both for myself and the people I care for. You know, as I said, I've been a nurse for 25 years, but even from a young age, I remember, you know, I come from a racehorse bloodline of alcoholism and drug abuse. And as a kid, you know, some of my earliest memories were hearing my dad say, "Oh, your mother's a drunk." But then, you know, as I got older, even before I became a nurse, you know, it was a badge of honor for me. You know, you're a drunk. Yes, I am. But the injury, you know, really started to occur when I started to have consequences and problems, ending up in emergency rooms or hospitals or getting pulled over by the police or upside down in a car, you know, as a result of. And, you know, growing up in a family of doctors and me becoming a nurse, you know, it's been a strange journey for me. And because of the stigma that I experienced in my workplace and was subjected to, you know, when Katie and I were talking about this panel, the first thing that came to my mind, because I didn't get sober and stay sober, it's been a long journey with multiple rehabs and relapses. But, you know, it took me 20 years to get the 6.5 years sober that I have now. But I'm grateful for those experiences because I realize I have a disease and it's going to be with me for life. And fortunately, I've had some loving, compassionate, and patient people who didn't stigmatize me, welcomed me in, and showed me how to get the tools and support I needed to learn to live without substances and alcohol. You know, and the past 6 years of my life have been amazing, and that doesn't mean unicorns and bunnies and piles of money falling in front of me. Life still happens the same way it always has. You know, life has been very challenging in recovery because I can't grab a glass of whiskey when life gets hard. But I found a sufficient substitute in recovery therapy, the fellowship of the AA, NA, and other A communities, and a way of living that I've learned, sometimes quickly, sometimes slowly, of how to live life without altering my consciousness, whether life is good, whether life is challenging, or whether life is like it is most of the time for me, where it's just okay. You know, could be better, could be a lot worse. But since I've been sober, you know, my life has never been worse than it was when I was getting loaded. And, you know, now I used to think I was going to be doomed to a life of boredom because I couldn't get loaded or drink. And now I've learned, like Kitty and I were talking the other day, like I love being sober more than I love getting loaded. And I didn't think that was possible. But the stigma I encountered, you know, my last relapse 7 years ago, I had 9 emergency room visits, a couple of 5150s, DUI, upside down in a car, all in an 8-month period. And I remember going to the same hospital as a nurse, but not as a working nurse, as a drunk nurse. And literally every time they saw me, you know, sometimes I actually heard them say, "Oh, here's that drunk again. You know, let's get him out of here." And it was, you know, I had gotten to the point in my disease where I thought I'm never going to get this recovery thing, and I might as well go ahead and just drink until I die. You know, it was horribly damaging. But in the past 6 years plus, I've been recovering from my alcoholism and substance use disorder and recovering from childhood traumas, like Cassie was talking about, and recovering from the stigma injury. I realize it's just going to continue to get better if I stay on this path. And so I tell people, when you get to a place where you realize you really need help, keep knocking on the door, because eventually you're going to run into someone like me or Gracie or Katie or Kathy or Robert. You know, not only am I a healthcare provider, but I'm a recovering healthcare provider, and I'm thrilled to provide a safe place for people to come and say, you know what, man, if anybody understands, I really understand. And I promise you, I'm going to get you to a better place.
Wow.
But again, thanks for inviting me, Katie. I'm Dave, and I'm definitely a grateful recovering substance user and alcohol user.
Yeah, Steve.
And when I used, I really used. I wasn't just a shallow dip my foot in the pool kind of user. I was go into the deep end kind of user.
Thank you so much, Dave. Very inspiring.
You're welcome.
Robert, we'd love to hear from you, and then we'll kind of talk a little amongst ourselves.
Great, thank you for asking me to be a part of this today, Grace. Katie, I appreciate it. My name is Robert, and I'm used to saying I'm an addict, so I'm learning some new things here today myself. But that's from the environment I come from, which is rooms of 12-step. But it's not just recovery from drug use. It's mental health issues for me, childhood traumas, PTSD. There's kind of a whole lot going on in there, but through all of that, you know, I'm happy to say that, you know, 13 years ago, I found a way to rooms of 12-step, which helped me break a cycle of using that had been going on off and on for 25 years. And I didn't, you know, I was one of those that I really wasn't seeking recovery. I didn't want to stop. I was content with the way things were and had pretty much resigned to that. This is just the way life is. This is how I'm going to go out. And I was committed to that, as well as strongly as I'm now committed to being in recovery and staying clean and being part of a 12-step program, which meant I was all in. I didn't know for the longest time that I was self-medicating. I just thought I was dealt a really, you know, bad hand, and this is, you know, and I used that as a long time as an excuse to do what I was doing. I was one of those that couldn't hold down a job anymore, so my last job became, as I refer to, as a non-pharmaceutical sales rep, otherwise known as a drug dealer, because that's all I could manage to do. I couldn't do anything else, and even for that, I was late. You know, people would joke about it, but I just couldn't get anywhere on time. And I thought my life was all in, you know, I thought it was all under control. I thought I was making my own decisions. I thought I had freedom. I thought I had all these things that in reality, I was stuck, I was trapped. I didn't know how to get out. I digress. I had a period of time in my late 20s where I wasn't using anything at all. And so I had some familiarity with 12-step. I knew it was there, and that was sort of my reference, like, oh, no, if I'm ready at some point, I know that's there. But the reality of it was I was not taking any steps to get back there or to ask for that help again. I had resigned to living the way I was living. You know, there was an intervention known as the police department that intervened in my path one day and you know, changed the course of everything for me. I'd never been arrested, never been to jail, and I got the full package. I got arrested, I went to jail, and I went to prison. So I kind of left no stone unturned in that area as well. I don't feel like there's anything I need to go out there and explore again. I've done quite a bit, but that didn't, you know, I'd like to say that experience led me to recovery, but it took more than that, and it took more. It took me a little while longer after getting out of there to realize that if I keep doing what I was doing, I'm going to get what I got, which was another trip back to prison, and so somewhere along the line there, I know what happens. I had a friend who got into treatment, and in order to, you know, if people in treatment they want money and they want cigarettes. So my way of getting that to him was if I met him at a meeting. So I'd go to these meetings, not for me, but to meet with him and give him what he wanted. And I'd hang out there because it was awkward to leave once it started. And what happened is I started hearing the readings, and the readings started making sense, and I remembered things. And one of the things I remembered is that I hadn't worked all the 12 steps the first time around. And so I chose to, it took a little while, but I had an epiphany at a meeting one night that if I keep doing what I'm doing, I'm going to get what I got. and I've been back to dealing. So I had stuff in my truck, and I went out and I threw it away, and I went to a meeting the next night that I've been going to for probably about 6-8 weeks. And I told the truth, and I got honest with people and told them I needed help, and that I wanted recovery more than I wanted to use. And that sort of made all the difference in the world for me. And I'd like to say it all went smooth and peachy from there, but in recovery, it doesn't. Life happens. When one of the things for me that came up is, I started having suicidal thoughts. I just thought, I didn't think much of it. And I was embarrassed that they were coming on with so many years of recovery behind my belt or under my belt. And I didn't ask for help, and I didn't reach out. And as a result, now part of my story is that I'm a suicide attempt survivor. And that stigma, that for me, that created a lot more stigma than drug use. It's made it hard for me to tell openly at a lot of meetings. Yeah, I can tell you that I'm grateful that I survived. And my life has gone in a direction I never would have thought it would be, and doing the work that I'm doing today. A complete career change from what I was doing prior to, and really feel much more connected to people and recovery than I ever did before. And that's, the stigma with the drug addiction. I definitely felt that, people looked at me differently, especially when I had to share that I'd been to prison. That brought its own stigma. And now dealing with the mental health and suicide attempt brought another layer of stigma. So I'm learning to unravel and unpack that and live with that each day. And each day it's getting better. As best I can say is it's getting better. That's enough out of me. Thanks for having me here, Kate. Appreciate it.
Oh, thank you. Each one of your stories is so unique. One of the things that I've noticed about us is that our using behavior or drinking behavior is as unique to us as a thumbprint. So each story here is so unique. And Robert, I really appreciate you bringing up the stigma around mental illnesses, severe depression, where there's suicidal behavior. That is another layer of what we encounter in our recovery, because if we stop using and drinking and we still don't want to live, we need another kind of care. And thank you for that, for your honesty and for your willingness to open up in that way. I was hoping that, and we'll go to Cassie. Do you have an experience? Maybe this is just more of a moment where you were impacted by stigma or bias in a way as you sought help and support. Do you have an experience where a welcoming person changed the course and the direction of your recovery? I'm going to speak to that a little bit, and then we'll go to Robert and then Dave.
Of course. I think the moment where I really noticed that I had more acceptance was actually surprisingly through probation as a juvenile. It was the first time that someone actually listened to what I said, and they didn't see me as someone acting out and just being wild, using drugs and wanting to party. They saw that there were a lot of difficulties that helped bring me there, and they brought more understanding to that and looked at me as a person rather than someone that's just going wild. And I think having that understanding and being heard and actually listening to what I had to say was the most empowering piece to helping me want to make that change.
So that really points to the how do you treat stigma wounding or stigma injury? It is listening and validating and seeing you as you are. I was just thinking about how we say I'm Katie, I'm an alcoholic, or I'm Katie, I'm an addict, and how we're looking at that. And one of the things that we could say, we kind of use diabetes as kind of a way of framing how we talk about our chronic illnesses. So someone would say, well, I'm Katie, I have diabetes. So I can say, I'm Katie, I have alcoholism, which is very, very different than being identified entirely as someone who is alcoholic. I just wanted to put that out there as we learn together how to use language, the language, what I call the language of dignity, really important. So Dave, you have any thoughts on when you encountered stigma, when you encountered maybe someone just going, okay, buddy, we got you? Muted. Unmute. We're so imperfect.
There we go. Can you hear me now?
Yeah.
As Cassie was talking about it, you know, I remember a couple of people at the beginning of my journey back in '99 who I credit with saving my life. It was a doctor initially, and after I developed a relationship with him, he referred me to a psychiatrist. But both of them spoke the language that they cared. It was non-judgmental. Like their actions and their words were congruent. You know, like what they said, they walked their talk. They showed up for me. One of them, the doctor, came to the rehab that I was at midnight to talk to me because he was frustrated because I was being stubborn. But he spoke to me like a loving father. You know, he said, I want to punch you in the, you know, chest and get your attention, or I'm going to have to throw you out. But it was the first time where I knew, and he was a recovering addict, you know, as well. And it was the first time that I felt like somebody understands me and they actually care, and maybe they are going to help me, you know. But like I said, it didn't happen overnight, and I had to go out and, you know, live on self-will and try using again unsuccessfully several times. But it opened the door to the possibility that when I encountered another caring soul that was non-judgmental, I'd listen a little more than I did with the first guy I gave a chance. And thus began my journey. And I hope other people don't have to be as stubborn and strong-willed and defiant as I had been to finally dive into this recovery journey with both feet instead of testing the water and going back out.
I love that you are now that person to so many, where you are that kind, strong support. That's the beauty of lived experience, is that you just clear the decks and you offer that human connection. It's beautiful. So Robert, there was a question on the Q&A, and I'd love to hear how stigma touched you and how a non-stigmatizing person or environment also not touched you. But there was a question out there who said the young man who went to prison, did corrections help with addiction treatment? Did you see that question?
I didn't see it, but I can answer that question. You know, did corrections help with addiction? Absolutely not. I was in prison. There was no, for me, there was no recovery offered. I know there's a, what do they call it? There is a portion of the prison that is just up on the tip of my tongue, that is for people in recovery, but I was not offered that. I was just left to just really spend my time reading books. That was my time. There was no recovery processing plan. There was no care there for my addiction. It was not addressed at all, unfortunately. And yeah, no, there was no recovery there. Short answer.
So no, the answer is no. We're hoping that changes. So were you impacted by stigma, and also a place where you found no stigma?
With regards to the prison, I actually found less stigma when believe it or not, when I started looking for jobs a couple of years afterwards. So I'd put some time under my belt. The first person who gave me an opportunity right out of prison was a friend who had a small business and knew my situation, knew my story, and gave me an opportunity to prove myself. It was all very, one bad move and I was out of there. But that gave me the foundation to, someone give me an opportunity, which made a huge difference for me. And I stayed there and committed to that job for, this was working in a pet store. And that's all I could handle at that time, because I hadn't had a job in over 7 years. So I didn't know how to work. I didn't know how to show up on time. I didn't know how to be, alert at 8 o'clock in the morning. That wasn't part of my story. So this person took a chance on me, and I stuck with them until I went on to, my next job, which took a while to get the nerve up to apply for another job, because I knew I was going to have to address these issues that were part of my past. But I got the strength and the courage to walk through those fears. And I'm not sure where it came from. And then I got a lot of support in the rooms of recovery. I did a lot of talking, a lot of working with sponsors. And even today with like what I've gone through with mental health, it's like, I just have to keep turning the next stone over and do the next indicated step. I just keep trying.
Beautiful. Thank you so much. So I'm thinking, we have this concept out there in the world of drug and alcohol treatment where we say no wrong door. So if someone walks into the ER, we want them to get care. If they walk into behavioral health, if they walk into primary care, if they walk into the county building. But my thing is no wrong door, and let's make sure there's a big welcome sign on every one of those doors. So that's our next work, is to really normalize substance use disorder and addiction as a chronic illness that requires care like any other. When I first started working in primary care, I was told that we don't treat addiction here. All alcohol and drug problems were quickly referred out of the building. And now we live in a world where primary care is one place that most people know that they can go in and ask for help. So it's changing very rapidly. We're gonna have a few questions and we're gonna switch over to Shelley. But one thing that I'd love to hear from you real briefly, this Recovery Month, it's September. You guys have stepped into the room to talk about yourselves in a really open, honest way. What would you like anyone who's attending here today know one thing that you would like to share about recovery, just real briefly? Cassie, you want to start with that one thing to give to the world today on Recovery Month?
I'd like to share that recovery might seem like the hardest thing that you go through. But in the end, a day in recovery today is so much more valuable than a single day when I was still using. And I would take that hard struggle and the difficulties of getting through that over again 1,000,000 times to be able to enjoy the days that I have today clean.
Beautiful. Thank you. How about you, Robert? One thing.
Yeah, you deserve it. You really do. We spend our time out there using and destroying, and recovery is a beautiful gift that you deserve to give yourself. And you're the only one who can do it. No one can give you this gift. So I hope you pursue it and get it.
Dave, one thing for the world.
Kind of along the lines of what Robert said, you know, as people who have alcoholism and addiction, you know, I'm an expert in suffering and just surviving and living in a miserable state. I can survive just about anything. And when I chose to stay in recovery and learn how to live like you guys have shown me how to live, the whole reason I used was to be comfortable in my own skin. And now, because of recovery, honestly, about 95, 96, 97% of the time, I have a peace that I've been searching for my whole life. And in those 3 to 5% where it feels just like it used to when I dove into a bottle or other things, I have the tools and support to get through it and know that it's not going to last forever. It's going to pass. And if I keep close to my herd, I'm going to be okay.
Beautiful.
So stay the course.
Beautiful. Thank you. Before I kind of make my contribution, I just want to let everybody know that the Medication Assisted Recovery Anonymous International link is in the chat and the questions. So if you're interested in following up, also that Mara has a wonderful Facebook page where talking about recovery in the context of also receiving medical care for your addiction is the norm in there. It's a beautiful, gentle, welcoming environment. I really love it a lot. For me, I just wanted to share that there was a moment when I fell in love with sobriety. When I first got sober, it was like somebody handed me a tender little baby, and I had to hold the baby always, fragile and beautiful. And I still carry that baby with me. The wellness and the safety of my sobriety is like my forever baby. But falling in love with sobriety, with the return to our spiritual wellness, our return to our health, our return to sense of connection with each other. Every recovering person is a healer and an artist. We're creative, and we know how to share really crucial gifts, our own medicine with others as we walk this journey. So I'm going to turn this over to Shelley. She's going to finish things up, and if she has any questions, I think there was one person that had their hand raised. I'll let you go there. Thank you, everyone.
Hi there. Hi, everyone. I just want to say thank you. Oh gosh, as someone in recovery myself, I was just smiling and my heart was open, and I was so grateful for all of you and everything that you shared. And you know, it takes a lot of courage, and you had your hearts open sharing with us, and I know that it was received. And you know, I was thinking, Katie, you asked about remembering a time where we experienced stigma, and it's strange. So I know that probably many of us have, but we've become, as a culture, destigmatized or desensitized to it. So I couldn't remember that, but I think that we always remember when someone treats us or speaks to us in that language of dignity, or you know, I heard David and Robert and Cassie talking about those people that they really were carrying with them. And so we remember that and the impact that has on our lives. And the other thing I wanted to share is we talked about how can we say things differently. We're all learning this new language, right? And I too am a member of the 12-step community. So that's what we do there. But sometimes I can say that I'm a person in long-term recovery, you know, and it says what we want to say, and it says it a little differently, and that's really my truth today. I'm not addicted in the way that I was. I'm a person in long-term recovery, and I really like introducing myself that way sometimes. But I want to thank you, Katie. As always, you are one of those people that speaks in that language of dignity. Yes, thank you. And so thank you for taking your lunch hour and all the time to help plan. And and David and Cassie and Robert, I feel super connected to you guys now, you know. And I have just a couple, you know, and everybody for joining us for this lunch hour. Thank you for joining the webinar and for your patience with our technology challenges. We're getting better, but I think in the end it all is working out really good. So I want to share just a couple things with you in closing, and here we go. Here we go. Okay, so Granite Wellness Centers, there is a number here on the slide. 855 Hope for You, for anyone who needs to reach out. The next edition of the Recovery and Wellness series is coming up on October 29th. It is Understanding Opiates and MAT, which is Medication Assisted Treatment. And we're also going to do a naloxone training, a brief naloxone training, and free giveaway of naloxone kits. And the way we're going to do that is when you tune in on Zoom to watch this and attend this session, then you're then eligible to come to several different locations. We'll have free naloxone available for a drive-through pickup. So that's coming up. And then also here you'll see this, trying to change the way you feel. We have a series of posters that, and there's a warm line number. It's a free and confidential text or call. If someone calls that number, they're automatically connected to a member of our MAT medical team at Granite Wellness to talk about treatment options and any questions or anything question anybody might have. So if you are a provider, medical or a provider in the community or someone in the community and you think you would like a poster, there are 3 different posters like this. If you would like this display, we have many available, and you can contact myself or Serenity about getting those. And also, let's see. The last thing I wanted to share is this reflection. So, a reflection for people in recovery. Celebrate your journey and your pain. You came from peril and pain to hopeful recovery. This is National Recovery Month, and you should stop and take a moment or a month to appreciate what that means. Give yourself credit for the never-ending composure and strength you muster. After all, you've outlasted addiction, you're tireless in your commitments, and you've built a better life. And you need to acknowledge all the progress you've made. Sometimes when our lives overflow with the subtle joys and rewards of ongoing recovery, we forget how far we've come, but we deserve credit. We continually transform adversity into something productive. And I found that reflection on Hazel and Betty Ford website, and I just thought it was a good one to share today. So with that, I'm done. Thank you all so much.
Thank you all. See you soon. Thanks, Dave, Cassie, Shelley, Robert. Bye-bye. Thanks, everybody.